So what about women?
I'm seeing more and more women all the time. Women are devastated if they have any hair loss. And typically what you'll see with women are two scenarios. One, they'll lose hair right here.
Okay.
And the second is a woman that's had facelifts or any kind of facial surgery, they'll lose hair here. And so both these get excellent results. And we'll transplant these sides, restore the hairline through here, and it's very natural, and they're very happy with the outcome. This scenario is natural. It's a genetic hair loss. It's called androgenic alopecia. It's a genetic hair loss. And
what age does that hit?
Normally after, let's say 35.
Okay.
You know, a lot of women when they go through menopause, they'll see hair changes. A lot of women, if this is going to happen when they have babies. You know,
so right in the front is where they get it. Okay.
Right, and you get, but if they're thinning all over, it's very difficult to treat. You got to have this specific pattern.
So when they're hitting in the front, which is very common,
those we transplant and get excellent results with them.
So for the women that are out there, by the way, and what do they tell you on the consult when they're losing their hair?
Well, I mean, they're losing their hair and they're devastated. You know, they don't want this. Well, we can do something about this. You know, we can stop the loss, we can treat the loss, we can restore it, and they're very happy with the outcome.
Are you just about 20% of your cases that you see women?
I don't think it's that high.
That high? You'd like to see more, though.
Oh, absolutely. Yeah, most women don't think there's anything they can do, and there is. I mean, if they would just come in, let me look at it, evaluate it, I can give them a pretty good idea of what to expect. I got a lot of women patients that they could talk to. They're more.
Oh, is that right? So they can talk to your patients.
Women are very more open to talk about this than men. You know, and so I have a lot of women patients that have had this done and are very happy with the outcome.
What about women that some of them maybe just have naturally a high forehead? Does that ever come up, and can you help that?
I want to lower it, but they don't.
Okay.
You know, I'll get women that are thinning in this area, and they got this high forehead, and I'll suggest that no, that's not what they want. They want to just restore what they've lost. This is.
Do you think their fear is the plug look? Still, is that still a fear?
Less and less all the time.
Okay.
You know, 10 years ago, yeah, that was very common. But now it's
maybe they just don't tell you, because I told you I'd love to get just a tiny bit on the side. You thought that nobody in the world notices but me. But the only reason I wouldn't want to do it is because I still feel like it would be noticeable.
Oh, you cannot tell it's hair transplant.
Really?
No.